doing our diabetic foot assessment today. We already started off by checking the reflexes in the knee and in the foot. Those were intact. The next thing we're going to do is we're going to look at the general appearance of the foot. We're going to look for some edema, which as you can see there is edema in this foot. And it looks like the edema would be +1 pitting edema. The next thing we're going to do is we are going to check for pulses in the foot. The outside pulse is a +1 and it's regular. The top of the foot pulse is very hard to find with the edema. Once again, I would say a +1, but you can tell that there is capillary refill, so the foot is getting blood supply. The next thing we're going to do is we are going to check the toenails. The toenails do seem to be intact. There does not seem to be any sores or lesions around the toenails. We're also going to check in between the toes. The skin does appear to be intact with no lesions and no wounds in between the toes. The next thing we're going to check for is we're going to check for sensation in the foot. We're going to have the patient close their eyes. Oh, you can't get his face. That's fine. And we're going to touch certain places on his foot and have him identify where we're touching it. So with his eyes closed, we're going to touch. Am I touching your foot?
Feels like you're touching the top.
Okay. Am I touching the foot now?
Don't think so.
Can you identify where I'm touching the foot at now? And how about now?
No.
So the patient was unable to feel the monofilament on his foot. The next thing that we are going to do is we are going to test the vibration. Do you feel that vibrating against your foot? Mm-mm. Can you feel that vibrating?
So much it is when you first eat it.
How about here? Can you feel it there?
Is it still vibrating?
Mm-hmm. Can you feel it now?
No. I just felt the touch.
Just the touch, but not the vibration? Okay. I'm going to try it against your ankle bone. Can you feel the vibration?
Yeah.
Okay.
Barely.
All right, I'm going to have you close your eyes now. And I want you to tell me, can you feel the vibration?
I think I just felt the touch.
Can you feel the vibration now? How about now?
Just a touch.
Okay. So he is unable to feel vibrations in the foot. So we would place this patient as being in a high risk. We would want to give education about checking the foot daily for wounds, for any kind of skin lesions or any kind of areas on the foot. And we would want him to make an appointment with his doctor right away if he did discover anything. All right, and that concludes our diabetic foot exam. Thank you.